Why is the BCG vaccine used for TB prevention worldwide? Imagine a tool that helps protect the most vulnerable from a serious disease. That's what the Bacillus calmette-guerin vaccine does for millions of children around the world. It is mainly used because it effectively prevents the most severe forms of tuberculosis in young children, especially those that can quickly become life-threatening. These severe forms include disseminated tuberculosis, which spreads throughout the body, and tuberculosis meningitis, which affects the brain and can cause long-term damage or death. In countries where tuberculosis is common, these dangerous conditions cause many deaths and disabilities in children. That's why many nations include BCG vaccination as part of their routine immunization programs for infants. Starting vaccination early helps reduce the number of children suffering from these serious complications and saves lives. While the vaccine is very good at protecting young children from the worst outcomes of tuberculosis, its ability to prevent the disease in teenagers and adults is limited and varies depending on where you are. Studies show that in some regions, the vaccine offers little to no protection for older age groups. Despite this, health authorities continue to use BCG because preventing severe disease in children remains a top priority. There is currently no other vaccine that offers better protection for this vulnerable group, making BCG an essential part of global tuberculosis control efforts. Interestingly, BCG may do more than just fight tuberculosis. Some research suggests that it can boost the immune system in a broader way, helping the body respond better to other infections. This phenomenon, called trained immunity, might help reduce overall infant deaths from respiratory illnesses and sepsis, which are common causes of death in young children. This additional benefit helps explain why many countries keep using BCG even in areas where tuberculosis rates are lower. However, BCG isn't perfect. Its effectiveness can depend on factors like geographic location and the population's health. It does not replace other important measures like early diagnosis and treatment of tuberculosis. In countries like the United States, where tuberculosis is less common, BCG vaccination is usually not recommended except in rare cases. This is because the risk of infection is low and the vaccine can sometimes interfere with tuberculosis skin tests, making diagnosis more difficult. In summary, the BCG vaccine is used worldwide because it is currently the best available tool to prevent the most dangerous forms of tuberculosis in young children, especially in places with high disease rates. It also appears to offer some extra immune benefits beyond tuberculosis prevention. Still, because it does not provide strong protection for adults, scientists are working hard to develop new, more effective vaccines. Until then, BCG remains a vital part of public health strategies to protect children from severe tuberculosis and save lives. Always remember to consult healthcare professionals for personalized advice and the most current information on tuberculosis prevention.